Which of the following biopsy techniques is most appropriate for obtaining a diagnostic sample from a suspected soft tissue sarcoma located deep within the muscle of a canine limb, and why? Answer: the most appropriate biopsy technique is needle aspiration or core needle biopsy. Reasoning: minimally invasive needle aspiration or core biopsy minimizes trauma to surrounding tissues compared to incisional or excisional biopsy, preserves tumor integrity. It reduces the risk of disrupting tumor architecture, which is critical for accurate histopathological diagnosis. Diagnostic sufficiency. Needle biopsy often yields sufficient cellular material for cytological or histopathological evaluation, especially for soft tissue sarcomas. Reduced surgical risk. Deep muscle tumors often require careful planning to avoid hemorrhage or infection. The needle techniques pose lower risk compared to larger incisions. Guidelines and reference laws. The American College of Veterinary Surgeons X guidelines emphasize selecting the least invasive diagnostic method that provides adequate tissue for diagnosis while minimizing patient morbidity. Dr. Smith is preparing to anesthetize a 6-year-old Labrador retriever with a history of chronic kidney disease for a splenectomy. The patient has been classified as a St. grade II. Which key factors must Dr. Smith consider in the anesthetic protocol, and what adjustments should be made? Answer: Dr. Smith must consider the following. Patient risk element through chronic kidney disease increases the risk of anesthetic complications, including hypotension and drug metabolism issues. Anesthetic protocol adjustments. Preoperative fluid therapy. Stabilize hydration and correct electrolyte imbalances, e.g., potassium and calcium. Drug selection. Avoid nephrotoxic agents like NSAIDs. Use opioids and non-nephrotoxic sedatives like dexmedetomidine. Induction agents. Use short-acting drugs such as propofol or alfaxolone to reduce prolonged systemic exposure. Maintenance anesthesia. Prefer inhalant anesthetics like isoflurane or sevoflurane for better control and rapid recovery. Monitoring. Continuous ECG, blood pressure and urine output monitoring are essential to detect early signs of hypotension or renal hypoperfusion. Capnography and pulse oximetry for respiratory and oxygenation status. Describe the significance of tumor grading in surgical decision-making and outline how histopathological findings influence prognosis. Answer: tumor grading involves assessing histological features such as cellular differentiation, mitotic activity, and necrosis to classify malignancy severity, influence on decision-making, and prognosis. Surgical planning. High-grade tumors may require wider surgical margins or adjunct therapies, e.g., chemotherapy. Low-grade tumors often have localized growth and can be treated with less aggressive approaches. Prognosis. High-grade tumors usually correlate with poor prognosis due to higher metastatic potential. Low-grade tumors are associated with longer survival rates. Guidelines and reference laws. Pathology guidelines recommend using established grading systems such as the WHO tumor classification for consistent diagnostic and prognostic reporting. Compare and contrast epidural anesthesia and peripheral nerve blocks for managing intraoperative and postoperative pain in canine orthopedic surgery. Answer: epidural anesthesia involves injecting anesthetic into the epidural space, effective for managing pain in surgeries involving the hind limbs, pelvis, or abdomen. Longer duration of pain relief. A risk: hypotension, infection, or accidental dural puncture. Peripheral nerve blocks. Target specific nerves, e.g., femoral sciatic for localized anesthesia. Provides highly localized pain control with fewer systemic effects. Risk: nerve injury or incomplete blockade. Guidelines and reference laws. The ACVS pain management guidelines recommend combining regional techniques with systemic analgesia for multimodal pain management. A histopathology report for a canine mast cell tumor resection states that the surgical margins are narrow but clean. The tumor is graded as intermediate. What are the next steps in patient management? Answer: reevaluation of margins. Although the margins are clean, the narrow margins less than 2 centimeters may still allow for local recurrence. Re-excision may be considered to obtain wider margins, particularly given the intermediate grade of the tumor. Adjuvant therapy for intermediate grade tumors. Radiation therapy can be an option to treat any remaining microscopic tumor cells in the vicinity of the surgical site. Postoperative monitoring. Regular follow-up exams with cytology or imaging are essential to detect any recurrence of the tumor. Prognosis. Even with clean margins, the intermediate grade of the tumor suggests that there could be a risk of metastases or recurrence, so long-term monitoring is crucial. Guidelines. The ACVS oncology guidelines emphasize the importance of ensuring wide margins for malignancies and suggest considering radiation if close margins are present in intermediate grade tumors. What is the role of frozen sections in intraoperative decision-making and what are its limitations? Answer: Role of frozen sections. Frozen sections provide rapid histopathological diagnosis during surgery. It is commonly used to check surgical margins or assess if lymph nodes contain metastatic disease, allowing surgeons to make immediate decisions about further resection or the need for additional treatments. Limitations: Frozen tissue processing is less detailed than formal paraffin embedding, and the results may not always be as accurate. Sampling errors can occur if only a small portion of the tumor is sampled. Technical limitations can arise, such as freezing artifacts, which can affect tissue architecture and hinder diagnosis. Guidelines: The ACVS Surgical Oncology Guidelines highlight that frozen sections are useful for confirming diagnosis in critical situations, but should be followed up with formal tissue analysis for final staging. Why is blood pressure monitoring essential during anesthesia in small animal surgery? Answer: Blood pressure monitoring is crucial during anesthesia to assess circulatory status and ensure adequate perfusion of vital organs, especially in animals with underlying conditions or undergoing high-risk procedures. Hypotension and complications: Low blood pressure can lead to hypoperfusion, causing ischemic damage to organs such as the kidneys, liver, and brain. It may also exacerbate pre-existing conditions like kidney disease or cardiovascular problems. During anesthesia, blood pressure often drops due to vasodilation caused by anesthetic drugs, which can be compounded by blood loss or fluid imbalances. Hypertension and risks: On the other hand, excessively high blood pressure can cause increased intracranial pressure and vascular rupture, especially in patients with pre-existing hypertension or cardiovascular disease. Guidelines: According to a CVS monitoring standards, blood pressure should be continuously monitored using either a Doppler or oscillometric method. Describe the significance of tumor grading in surgical decision-making and outline how histopathological findings influence prognosis. Answer: Tumor grading is essential for evaluating the aggressiveness of cancer and predicting its potential to metastasize. Grading typically assesses cellular differentiation, mitotic activity, and necrosis. Surgical decision-making: High-grade tumors, poorly differentiated, often have higher mitotic rates and are more likely to spread. These may require wider surgical margins and additional treatments such as chemotherapy or radiation. Low-grade tumors, well differentiated, and are typically more localized, so a simple excision with smaller margins may be sufficient. Prognosis: Tumor grade directly correlates with prognosis. High-grade tumors generally indicate poorer outcomes due to their rapid growth and increased risk of recurrence and metastases. Low-grade tumors are more likely to be benign, with a lower chance of spreading, leading to better survival rates. Compare and contrast epidural anesthesia and peripheral nerve blocks for managing intraoperative and postoperative pain in canine orthopedic surgery. Answer: Epidural anesthesia involves injection of local anesthetics into the epidural space, providing regional analgesia for surgeries involving the hind limbs, pelvis, or abdomen. It offers prolonged pain relief postoperatively, reducing the need for systemic opioid administration. However, it carries risks like hypotension, infections, and neurological complications if not properly performed. Peripheral nerve blocks involves direct injection of anesthetic around specific nerves, e.g. femoral sciatic. It is ideal for providing localized anesthesia for limb surgeries and is especially useful in smaller, more localized procedures. The risk includes nerve injury or incomplete blockade, though complications are generally fewer compared to epidural anesthesia. Comparison: Epidural anesthesia is better suited for more extensive surgeries requiring broad analgesia, while peripheral nerve blocks are preferred for isolated limb surgeries where localized pain control is sufficient. What is the role of tissue culture and sensitivity in managing infected wounds during surgery? Answer: Tissue culture and sensitivity testing are critical in guiding the treatment of infected surgical wounds, especially when conventional antibiotics fail or the infection is persistent. Tissue culture: The first step is obtaining a sample from the infected wound for culture. This helps identify the specific pathogen, bacterial, fungal, or viral, causing the infection. Cultures provide valuable information on the bacterial load and help assess the presence of biofilms, which complicate wound healing and antibiotic efficacy. Sensitivity testing: Sensitivity testing determines the antibiotic resistance or susceptibility of the isolated pathogen to various antibiotics. This allows the surgeon to choose the most effective targeted antibiotic, minimizing the risk of antibiotic resistance and treatment failure. Impact on management: If an infection is present, antibiotics should be selected based on the culture and sensitivity results rather than empirical treatment. In some cases, a change in antibiotic protocol may be necessary if the pathogen shows resistance to first-line treatments. Discuss the key factors a veterinary surgeon must consider when deciding to proceed with surgery in a patient whose owners have financial limitations. How does this relate to ethical principles and legal considerations? Answer: when deciding to proceed with surgery in a patient whose owners have financial limitations, the veterinary surgeon must consider several key factors. Patient welfare: the primary consideration should be the patient's quality of life and potential outcomes. If surgery is necessary for survival or to relieve significant pain, it should be prioritized. Client communication: open, empathetic communication is essential. The surgeon must explain the diagnosis, prognosis, and all available options, including cost-effective alternatives if surgery is unaffordable. Informed consent: clients must fully understand the benefits, risks, and costs of treatment options. Consent must be documented. Ethical principles: the surgeon must act with non-maleficence, do no harm, providing the best care regardless of financial constraints, and justice, treating all clients equitably. Legal considerations: clear documentation of all discussions and decisions is crucial for avoiding malpractice claims. The surgeon should respect the client's autonomy, ensuring decisions align with legal standards for patient care. Dr. Emily has been approached by Mr. Carter regarding his dog, Max, who has a fractured femur. Mr. Carter can only afford a conservative management plan, but Dr. Emily believes surgery offers the best prognosis. Mr. Carter is hesitant due to financial concerns but is unsure of the implications of not proceeding with surgery. What steps should Dr. Emily take to handle this situation ethically and legally? Answer: Dr. Emily should take the following steps. Discuss options clearly. She should present all available options, explaining both the surgical and conservative management plans in detail. The benefits and risks of each should be thoroughly outlined, especially regarding the long-term prognosis of the fracture with conservative treatment. Address financial concerns. Dr. Emily could explore financing options or direct Mr. Carter to resources such as animal welfare organizations that might assist with costs. Ensure informed consent. Dr. Emily must ensure Mr. Carter fully understands the consequences of both options, documenting his decision to proceed or decline surgery. Respect client autonomy. Although surgery may be the best option medically, Dr. Emily must respect Mr. Carter's decision if he opts for the less invasive treatment, as long as it doesn't cause undue suffering to Max. Document thoroughly. It is essential to document every conversation, the advice provided, and the client's decision in case of future disputes. This approach adheres to ethical guidelines, such as the veterinary client-patient relationship (EER), ensuring that both patient welfare and client autonomy are respected. What are the critical principles of antimicrobial stewardship that veterinary surgeons must follow to combat antimicrobial resistance in surgical settings? Answer: the critical principles of antimicrobial stewardship in veterinary surgical settings are judicious use of antibiotics. Antibiotics should only be used when clearly indicated, such as in surgeries with a high risk of infection or in treating confirmed infections. Selection of appropriate antibiotics. Surgeons should use narrow-spectrum antibiotics that target specific pathogens rather than broad-spectrum ones, minimizing the risk of resistance. Optimal dosage and duration. Antibiotics should be administered at the correct dose and for the shortest effective duration to avoid unnecessary exposure and prevent resistance development. Infection prevention. Maintaining high standards of aseptic technique, preoperative antiseptic procedures, and post-surgical care can reduce the need for antibiotics. Monitoring and reviewing. Regular monitoring of infection rates and antibiotic resistance patterns should inform decisions and lead to adjustments in protocols. These principles align with the One Health initiative advocating for responsible use of antimicrobials to protect both human and veterinary health. The CDC's core elements of antibiotic stewardship in veterinary settings provide further guidance. Compare and contrast the use of prophylactic versus therapeutic antibiotics in veterinary surgical practice, citing relevant risks and benefits. Answer: prophylactic antibiotics. These are given before surgery to prevent infections in high-risk procedures. Benefits include reducing the incidence of surgical site infections, SS in clean contaminated or contaminated surgeries, such as orthopedic procedures. However, overuse can lead to antibiotic resistance and disruption of normal flora. Therapeutic antibiotics. These are used to treat active infections, such as those diagnosed postoperatively or in patients with pre-existing infections. Benefits include targeting specific pathogens and resolving infections. However, misuse or delay in initiating therapy can worsen the infection, prolong recovery, and increase resistance. The decision between the two depends on factors like the nature of the surgery, the patient's condition, and potential for infection. Veterinary surgeons should follow guidelines from AAHA and the AVMA to minimize the risks of resistance and ensure effective treatment. Dr. Lopez notices an increase in surgical site infections (SIS) at her practice. The facility recently began using a new sterilization protocol for surgical instruments. How should Dr. Lopez investigate and address this issue? Answer: Dr. Lopez should follow these steps. Audit the sterilization process. She should assess the new sterilization protocol for any discrepancies in procedure or equipment. This includes verifying that sterilization indicators are used properly and equipment is appropriately maintained. Examine other factors. Review infection control practices including staff hand hygiene, proper draping, and the sterile field during surgery. Collect data and investigate. Cultures should be taken from surgical instruments, environmental surfaces, and infected sites to identify any pathogens. This will help determine if there is a specific source of the infection. Revise protocols as necessary. Based on findings, Dr. Lopez may need to update the sterilization procedures or retrain staff to adhere strictly to infection control guidelines. Monitor results. After implementing changes, it's important to track infection rates to determine the effectiveness of new measures. Following protocols from AORN and CDC guidelines on infection prevention in surgical settings will ensure best practices are being followed. Describe the importance of documenting informed consent in veterinary surgery and the potential legal ramifications of inadequate documentation. Answer: documenting informed consent is essential for ensuring that clients understand the proposed treatment, associated risks, and potential alternatives. It serves as both a legal and ethical safeguard for the veterinary surgeon, ensuring transparency in decision-making. Key elements of proper documentation include treatment description, detailing the procedure including risks and benefits. Alternatives, outlining other available options if applicable. Client understanding, verifying that the client understands the implications of treatment and their decision. Client decision, documenting the client's decision to proceed or decline treatment. Inadequate documentation can result in legal ramifications such as allegations of malpractice or claims of unauthorized treatment. It can also undermine the patient's right to make informed decisions, leading to disputes in court. The AVMA guidelines on informed consent stress that thorough documentation is crucial for protecting both client autonomy and the veterinarian's legal standing. Explain the ethical dilemma of euthanasia in veterinary surgery when a client requests it for financial reasons rather than medical necessity. Answer: euthanasia for financial reasons rather than medical necessity presents an ethical dilemma for veterinary surgeons. On one hand, the surgeon has an obligation to beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Performing euthanasia when it is not medically necessary could cause unnecessary suffering and deprive the patient of possible treatment outcomes. On the other hand, the veterinarian must also respect the client's autonomy and their right to make decisions based on personal circumstances. If the client insists on euthanasia, the surgeon must ensure that the decision is well-informed and voluntary. To resolve this, the surgeon should clearly communicate the potential benefits of alternative treatments and explore options such as financial assistance or payment plans. The surgeon should only proceed with euthanasia if it is the most humane option. Proper documentation of the decision-making process, including discussions about alternatives, is essential to protect both the patient and the surgeon legally. This dilemma aligns with EMA's principles of veterinary medical ethics, which emphasize the importance of empathy, transparency, and patient welfare. What protocols should a veterinary surgeon follow to minimize nosocomial infections in their practice? Answer: to minimize nosocomial infections, veterinary surgeons should implement the following protocols. Hand hygiene, regular hand washing, and the use of alcohol-based hand sanitizers are essential to prevent the spread of pathogens. Sterilization and disinfection. Ensure that all surgical instruments are properly sterilized and that operating rooms are cleaned and disinfected between procedures. Aseptic technique. Surgeons should follow strict aseptic techniques, including wearing gloves, masks, and gowns during surgeries. Preoperative care. Pre-surgical skin antisepsis, including the use of chlorhexidine or iodine-based solutions, should be standard practice. Staff training, continuous education on infection control practices is necessary for all personnel to reduce the risk of contamination. These protocols align with the CDC infection control guidelines for veterinary practices, which aim to prevent infections and ensure patient safety. Why is client communication critical in the decision-making process for veterinary surgery, and what factors should a surgeon consider in these discussions? Answer: client communication is critical in veterinary surgery because it ensures that the client is fully informed about the treatment options, risks, and expected outcomes. The surgeon must consider several factors during these discussions. Understanding the client's concerns. The surgeon should listen to the client's concerns, which may include emotional, financial, or logistical factors, and address them thoughtfully. Providing clear information. The surgeon should explain the surgical procedure, risks, and benefits in language that the client can understand. Respect for client autonomy. The client must be allowed to make an informed decision free from coercion. Follow-up. Discussing potential outcomes and the follow-up care needed is crucial for managing expectations. By following these principles, the surgeon can uphold ethical standards and avoid legal issues, ensuring a positive outcome for both the patient and the client. What are the potential consequences of failing to meet veterinary surgical standards, and how can these be avoided? Answer: failure to meet veterinary surgical standards can lead to complications such as increased risk of infection, poor patient outcomes, and potential harm to the patient. Legal consequences may include malpractice lawsuits or loss of licensure. To avoid these issues, veterinary surgeons should adhere to established protocols, follow standard operating procedures for sterilization, anesthesia, and post-surgical care. Ongoing education. Keep abreast of the latest surgical techniques and infection control practices. Documentation. Ensure thorough and accurate documentation of all decisions, treatments, and client communications. Patient monitoring. Regularly monitor the patient's recovery to detect complications early. By adhering to best practices and ethical guidelines, surgeons can reduce the risk of negative outcomes and ensure both patient safety and legal compliance. Explain the decision-making process and surgical techniques involved in managing an acute abdomen with gastrointestinal perforation. Answer: managing an acute abdomen with gastrointestinal perforation requires urgent attention to both stabilization and definitive surgical intervention. The first step is stabilizing the patient, often involving fluid resuscitation with crystalloids and electrolytes to correct hypovolemia and dehydration, as well as broad-spectrum antibiotics, e.g. cefazolin with metronidazole, to combat potential infection. Diagnostic imaging, radiographs, and ultrasound helps identify signs like free air or fluid in the abdomen, confirming perforation. Surgical intervention typically involves exploratory laparotomy, which allows the surgeon to locate the site of perforation, often in the stomach or small intestine. Once identified, the perforation is repaired with either a primary closure or a segmental resection, depending on the severity of tissue damage. Peritoneal lavage is performed to clear contaminants from the peritoneal cavity. Postoperatively, managing the risk of sepsis and ensuring proper nutrition, enteral feeding once ileus resolves are critical. Analgesia and ongoing monitoring for complications like abdominal wound dehiscence or peritonitis are also necessary. Why is the timing of cleft palate repair critical, and what are the main surgical techniques employed? Answer: timing is critical in cleft palate repair to optimize feeding, growth, and development. The recommended age for surgery is typically 1 to 6 weeks, balancing the need for tissue growth with the risk of speech, dental, and hearing problems later in life. Early repair reduces the likelihood of developmental delays, poor feeding, and recurrent ear infections. The main surgical techniques for cleft palate repair include von Langenbeck technique, whereby lateral mucoperiosteal flaps are created and advanced to close the defect; overlapping flap technique, which is often used for wider clefts. This technique ensures better closure and reduces tension on the wound. Postoperative care includes feeding modifications, liquid diets, initially pain management, and minimizing activity to prevent dehiscence. A common complication is velopharyngeal insufficiency, which can lead to speech issues, making careful surgical technique and postoperative care vital. Guidelines from the Veterinary Surgical Small Animal Manual advocate for early intervention to avoid secondary issues like chronic rhinitis or nasal regurgitation, improving the long-term prognosis. Dr. Simmons receives an 8-year-old Labrador Retriever Max presenting with progressive dyspnea, jugular distension, and muffled heart sounds. An echocardiogram reveals a significant pericardial effusion causing cardiac tamponade. What should Dr. Simmons do next? Answer: Dr. Simmons should immediately perform pericardiocentesis to relieve the pressure caused by the pericardial effusion. This is done using a sterile technique, often with ultrasound guidance, to safely guide a needle or catheter into the pericardial sac to aspirate the accumulated fluid. The procedure helps to alleviate the symptoms of tamponade, such as dyspnea and muffled heart sounds, and stabilize the patient. After pericardiocentesis, Dr. Simmons should send the fluid for cytology and culture to determine the underlying cause of the effusion, such as neoplasia, hemangiosarcoma, or idiopathic pericarditis. If the effusion recurs or is persistent, Dr. Simmons may need to consider pericardectomy, which involves surgical removal of part or all of the pericardium to prevent further fluid accumulation. Postoperative monitoring includes checking for recurrence of effusion, managing any underlying conditions, and ensuring the patient is stable before discharge. Guidelines from the American Heartworm Society stress the need for quick intervention to prevent circulatory collapse and improve the chances of survival. Discuss the anesthetic considerations for a geriatric patient undergoing splenectomy for a hemodynamo. Answer: geriatric patients have unique anesthetic needs due to age-related changes in organ function, which require careful consideration. The first step is a thorough pre-anesthetic evaluation to assess cardiovascular health, renal function, and any comorbidities, e.g., diabetes, heart disease. Common concerns include reduced hepatic metabolism, renal clearance, and possible arrhythmias. For anesthesia, induction, propofol or alfaxalone is typically used for smooth, rapid induction without excessive cardiovascular depression. During maintenance, isoflurane or sevoflurane is preferred as they are easier to control and have minimal cardiovascular effects. Intraoperative monitoring is essential to track vital signs and ensure adequate perfusion, especially in cases of hypovolemia from hemoabdomen. Multimodal analgesia is employed to minimize stress on the cardiovascular system using opioids, e.g., fentanyl, and local anesthetics, e.g., lidocaine. Postoperative care includes careful fluid management, pain control, and monitoring for complications such as hypotension or arrhythmias. Due to the geriatric patient's compromised healing ability, nutritional support and restricted activity are also crucial. Describe the steps and postoperative considerations for surgical correction of a congenital extrahepatic portosystemic shunt. Answer: surgical correction of a congenital extrahepatic portosystemic shunt (PSS) is often indicated to prevent long-term complications such as hepatic encephalopathy. Preoperatively, the patient is stabilized with a low-protein diet, lactulose, and antibiotics to reduce ammonia levels. The main surgical technique involves placing an amyloid constrictor or cellophane band around the shunt, leading to gradual occlusion. This technique minimizes the risks of portal hypertension and ischemia that can occur with immediate ligation. The constrictor is placed around the shunt near the portal vein. Postoperative care involves monitoring for complications such as portal hypertension, ascites, vomiting, and ensuring proper liver function. Post-surgical feeding is gradually reintroduced to avoid stress on the liver, and patients are closely monitored for signs of hepatic failure. The Small Animal Surgery textbook emphasizes the importance of gradual closure to avoid rapid changes in portal pressure, which can lead to further complications like ascites. Nutritional and medical management postoperatively are key to a successful outcome. Impaired thoracostomy tube placement and emergency thoracotomy for the management of pneumothorax. Answer: both thoracostomy tube placement and emergency thoracotomy are techniques used in the management of pneumothorax, but they are indicated in different clinical scenarios. Thoracostomy tube placement is the first-line treatment for non-tension pneumothorax. The procedure involves inserting a tube into the pleural space, typically in the 7th-9th intercostal space, and applying continuous suction to evacuate air. It is less invasive and allows the patient to be stabilized without major surgery. However, if a pneumothorax is tensioning or if there is persistent air leakage due to lung laceration or other structural damage, emergency thoracotomy is required. This invasive procedure involves opening the thoracic cavity to directly repair the lung tissue, which may include suturing or stapling damaged areas. Both procedures have their risks, but thoracostomy is generally safer and quicker. CCS guidelines advocate for thoracostomy as the initial treatment, reserving thoracotomy for cases unresponsive to conservative management. Why do geriatric patients have delayed wound healing, and what measures can improve outcomes? Answer: geriatric patients experience delayed wound healing due to several factors: reduced fibroblast activity, decreased angiogenesis, and the presence of comorbid conditions like diabetes or cardiovascular disease. As aging decreases the ability to form new blood vessels and collagen, the healing process is slower and wounds are more susceptible to infection and dehiscence. To improve healing outcomes, nutritional support is essential, with an emphasis on high-protein diets and supplementation with omega-3 fatty acids to promote tissue repair and inflammation reduction. Use of advanced wound care products, e.g. hydrocolloids, alginates, can also enhance healing by maintaining a moist wound environment and reducing the risk of infection. Postoperative care focuses on minimizing activity to prevent stress on the wound site, controlling pain, and monitoring for signs of infection. Ensuring adequate oxygenation and circulation is also crucial. The AVMA wound healing standards recommend comprehensive care plans for older patients to ensure that they receive appropriate nutritional, environmental, and medical support for optimal recovery. How should growth plate injuries be managed to prevent long-term complications? Answer: growth plate injuries in pediatric patients require prompt and appropriate intervention to avoid long-term issues like angular limb deformities or stunted growth. The first step is accurate diagnostic imaging, such as radiographs or CT scans, to assess the extent of the injury. Non-displaced fractures are typically managed with conservative treatment, splinting or casting to stabilize the joint and allow for natural healing. However, displaced fractures often require surgical intervention. Procedures like closed reduction and percutaneous pinning or open reduction with internal fixation are employed based on the location and severity of the fracture. Post-surgical management includes monitoring for signs of limb overgrowth or underdevelopment, both of which can occur due to uneven healing of the growth plates. Physical therapy is encouraged to promote joint mobility and prevent stiffness. The AAOS Pediatric Orthopedic Guidelines emphasize early diagnosis and treatment to prevent long-term functional deficits. How does a perineal hernia in dogs affect their quality of life, and what are the treatment options? Answer: perineal hernias in dogs, often seen in middle-aged or older male dogs, can significantly affect their quality of life by causing discomfort, difficulty defecating, incontinence, and even systemic infection if left untreated. A hernia results in the protrusion of abdominal contents through the pelvic diaphragm, leading to the displacement of organs like the rectum or bladder. Treatment options include surgical repair, which may involve herniorrhaphy or rectal repositioning, and sometimes the use of synthetic mesh to reinforce the pelvic diaphragm. In some cases, colostomy may be needed if the hernia is large or recurrent. Postoperative care focuses on pain management, infection control, and monitoring for complications like fecal incontinence. Dogs may require temporary stool softeners or changes in diet to prevent strain on the surgical site. Veterinary surgical guidelines highlight the importance of long-term follow-up, as recurrences can happen if the surgical site is not adequately supported. What are the key considerations in managing a dog with a suspected slipped capital femoral epiphysis (SE)? Answer: slipped capital femoral epiphysis (SE) is a condition where the femoral head displaces relative to the femoral neck, often seen in adolescent, overweight dogs. The primary consideration is early diagnosis to avoid joint degeneration. The diagnosis is confirmed via radiographs showing slippage at the growth plate. Conservative management, rest and pain relief may be considered for mild cases, but surgical intervention is often necessary for more severe cases, such as capital realignment or femoral head and neck excision. The goal is to restore function and reduce pain. Postoperative care involves restricted activity for several weeks to allow the joint to heal, alongside pain management and physiotherapy to maintain range of motion. Early surgical intervention improves long-term outcomes. Guidelines from the ACVS stress the importance of immediate intervention to avoid the development of osteoarthritis or joint deformities.